Welcome, welcome. This is Dr. Amigues, your friendly rheumatologist, and at Unabridged MD. It's such a pleasure to be here with you talking about another rheumatologic topic. And today we're going to talk about Sjgren, Sjgren, so Sjgren. We're going to really talk about what it is. And next time we'll talk about how we diagnose it, and the time after we'll talk about how we treat it. So it's actually the most common autoimmune disorder, at least in Europe. It's been the diagnosis, like the first time it was diagnosed was by the physician that was named Sjögren, and he is Swedish. He was, because he's past dead, but he was Swedish. And when you actually look at who gets Sjögren, very often there are patients that are coming at least partially from the northern of Europe, so northern Europe. So Sjögren is an autoimmune disorder. As you have heard me talk about this, is when there's an autoimmune disorder, it's basically that your immune system is recognizing something as abnormal and that should not be here. And so basically your body is causing some inflammation because they are trying to get rid of what they think should not be here. And that is really what an autoimmune, auto for self, immune for immune system. So that's an autoimmune disorder. So Sjgren, Sjgren basically is going to affect the excretory gland. So basically it's going to affect it's going to cause dry eyes, dry mouth, and can also cause other symptoms of dryness in the vagina, for example. And it can cause other symptoms, and I will talk to you about them after. But what is important for Sjgren is to realize that what's happening is that at first we think that there is inflammation in the glands that are creating this, the tears, and the glands that are creating the saliva, the glands that are creating the moisture in the vagina. And that this inflammation ultimately gets fibrous, basically gets scar, like leads to scarring. And then the glands just don't work like the way they are supposed to work. If you were, and when we do a biopsy of the salivary gland, so we can actually, if you touch your lips, the inside of your lips, you can feel that there's a couple of bumps. Well, those bumps are basically extra salivary glands. So they are minor salivary glands. So we have the big ones here, the parotid, that create a lot of saliva. We have under the submandibular that also create quite a bit of saliva. But then we also have those small ones under the lips. Okay, and so we can actually go and grab some tissue and look at it. And under the microscope, what we find is that there is infiltrates of inflammation, so inflammatory cell called lymphocytes. You don't necessarily need to know this, but we also see scarring. And so it's this association of scarring plus the fact that there is inflammatory cells that can tell us, okay, yeah, this looks like Sjgren. So you have this there. You can have, if we were to do a biopsy of, bigger salivary gland, we would probably see that too. If you were to do a biopsy of the lacrimal gland, which I don't recommend, we could see that. What it does, so that's the main symptoms, and that is what we call Sjgren. And then you want to have the positive antibody. So there are patients who will have Sjgren where if you do a biopsy, you see those signs and those changes, and they will not have positive antibodies, but usually you have positive antibody. Those positive antibodies are usually either ANA and or SSA, SSB. This is a very interesting one. SSA, SSB, which means Sjgren A, Sjgren B. Those antibodies can be actually positive with a negative ANA. And remember last week we were talking about the ANA? This is one of those times where the ANA can be negative and you can have SSA, SSB positive. So that's important. So in general, just make sure if you're thinking that you may have Sjgren because you have dry eyes, dry mouth, you're very fatigued, Make sure that you also throw their SSC, SSB, just to make sure that you're not missing a Sjögren syndrome. Okay, so dry eyes, dry mouth, dry vagina, and then fatigue. But you can also have joint pain. Same thing than all of our inflammatory syndrome. This pain is worse in the morning, associated with morning stiffness, and it's improved with exercise. Okay, and then there is this fatigue, severe fatigue. Patients with Sjögren very often complain of very, very deep fatigue. And very interestingly, as you improve the symptoms of Sjgren, you can actually help with the fatigue. But that's really one of the most common symptoms of Sjgren. And so that's really important to know. And then you can have other symptoms that are much more rare, but those would actually need a lot more treatment. So you can actually have interstitial lung disease or lung disease involvement of your Sjgren. There are specific symptoms that are specific for Sjgren, so that's actually quite important. And then there can be some neuro. Hi, Ragdak. Yes, I finally figured Instagram. That's what it was. So I was talking about the joint. I talked about the fatigue. I talked about the lungs. You can also have nerve damage from Sjgren. And that can actually cause two types of nerve damage. So this is actually, it's kind of exciting to say that. There's a lot of patients that have Sjgren that have, when you actually look, they're going to be said, oh, they have fibromyalgia. Fibromyalgia, remember, is the soft tissue tenderness above and below the waist. So if I were to hug you, you're like, please don't hug me. This is hurtful. If I touch your arms, you're in pain. Or basically really all over your body, you may be in pain. When you have that, that's when I look for small fibers neuropathy. So that's actually quite exciting. Small fibers neuropathy, so you have large fibers neuropathy, that would be diagnosed with an electromyogram. So we stimulate you with some current and we see how you respond with your nerve. That's large fibers neuropathy. Small fibers neuropathy is really interesting because you have all of this pain and it is due to nerve. But if you do an EMG, it's normal because it hasn't affected the large nerve. What it does is that if you were to do a biopsy of the skin and go pretty deep, you actually would see that there's less nerve ending. And the fact that you have less nerve ending leads to more pain. We are very well done, right? And so it's a balance, and you need to have nerve ending to know that you have no pain at that moment for your body to process. And so if you don't have enough nerve ending, you're losing the signal, and so then you develop pain. Okay, so patients who have severe fatigue and fibromyalgia, when we say, oh, they have fibromyalgia, I always wonder if it is Sjgren. So I always check for Sjgren in those patients. And it's really just a question of asking, do you have dry mouth? Do you have dry eyes? And then doing some tests to see that, okay? So I think those are like the main one. Then the last main big one is urine. So you can actually have kidney involvement in Sjgren. It's a very specific type of kidney involvement that is not as known as, for example, lupus nephritis, for example. It's what we call renal tubular acidosis. And a hint to that is if you have recurrent infection and or recurrent kidney stones. So if you have that, know that it can be a sign of Sjgren, especially if you have dry eyes, dry mouth, and so on. And then finally, I would not talk about systemic disease if I forgot to mention that you can have skin involvement in Sjgren. So the skin involvement is usually going to be what we call a vasculitis, so inflammation of the vessel, which is going to lead to dots. It's almost like dots on your skin, and it can be caused by cryoglobulinemia. So those are like protein that clumps together when there is cold weather. And you can also have it even if you don't have cold. And that's those, all of those very other than the fatigue, the joint pain, the dry eyes, dry mouth, those other manifestations are actually quite severe and necessitate more immunosuppression. Okay. The last, so when we are, so those are like, symptoms that we're looking at, and then you have the blood work and the urine analysis. So I talked about the urine analysis. If you have a kidney involvement, we always want to make sure you don't have kidney involvement. And then we're going to look at your blood work. One thing that's really quite important in Sjgren is the fact that because the main issue is the lymphocyte, as I was mentioning earlier, patients who have ongoing Sjgren for a very long time, and also like the severe type of Sjgren, they can actually develop a hematologic malignancy called lymphoma. And the lymphoma you can actually pick it up before, if you were to do some type of blood work. And that is why we always, or at least we should, that standard of care, someone that has Sjgren should check at least once a year, if not twice a year, the what we call SPEP and immunoglobulin, because you really are looking if there is any evidence that this is getting worse. And if you're having more protein in your blood, because that may mean that you're making some type of immunoglobulin, and that may show that your lymphocytes are creating that. And so that's a sign that maybe there's something going on. So we also check the lymph nodes and see all things like that. So normally at the end, it's been 11 minutes. At the end of this 11 minutes, you have understood that Sjgren is an autoimmune disorder, that it's your body seeing something that per them should not be here and is kind of attacking your own cells, that it involves the salivary gland, so it causes dry mouth, dry eyes, dry vagina, can cause skin involvement, can cause severe fatigue. I forgot to mention that, and can cause fever sometimes. It can lead to neuropathy. Either it's large fibers neuropathy or it's small fibers neuropathy, which would present like fibromyalgia. It can cause cutaneous changes, especially if you have cryoglobulinemia from it. Can cause lung involvement, and then joint involvement. And then finally, if you have severe lymphoma, can actually potentially cause severe Sjgren, can cause lymphoma. The good news, we have good treatments. All right. And there are things that you can do that doesn't need your physician. So that's all good news. All right. So I'm going to stay here for a little bit, looking at you in the eyes in the computer, if you have any questions. But basically, this is what is Sjgren. Next week, we will talk about how we diagnose Sjgren. I started touching upon this, but I think it will be a shorter version. How do we diagnose Sjgren? If you want to ask me questions, don't hesitate. You can put them as comments under the lives. Now that I've finally figured out Instagram. PSA, it's just that it takes a longer time. That's what it is. So I just needed to be patient, which is not my highest quality. And overall, I'm very excited to talk with you next week for more episodes of Rheumatology 101. I hope this was useful. I think this should really give you an idea of when you should think of Sjgren. It's definitely underdiagnosed. And, I gave you the most common symptoms. Know that there are other symptoms that we're thinking. You can have biliary issues. So if you suddenly become yellow and you have a positive ANA, we definitely want to see that. But the ones that I've talked to you are really the ones that we should always look for if we have even the slight thought that maybe this is Sjgren. All right. Okay. Well, past 14 minutes. I will see you next week. Thank you always for seeing. If you're watching the replay, put #replay. It puts the I don't know what they call, but basically it allows more people to watch it. Really, this is a work of love. I love rheumatology and I love sharing my education with all of you. And so if you can share this, the more the merrier. All right. Have a wonderful day. Take care, everyone. Bye-bye.